Good afternoon.
Afternoon.
Hiya. So if you just introduce yourself to the student and let them know a bit about your role and the company that you work for.
Yeah, okay. So my name's Helen. Helen Ross. I'm one of the doctors at the Kingsmill Hospital. I'm a GP trainee. So when I'm training to become a general practitioner, I'm in my first year of training, and it's a 3-year training course. As I said, I'm currently working at the Kingsmill Hospital, which is in Mansfield. So I'm sure you all know where it is. It's what we call a district general hospital. So it's fairly well equipped, but we don't have certain specialities like neurosurgery. We don't have in that hospital. And it's about 550 inpatient beds, and we see about 30,000 patients that come in as inpatients every year as well.
That's a lot of people.
It is a lot of people. It's probably a little bit more at the moment as well.
Yeah, with COVID. So
Yeah.
how do you kind of fit in terms of your role at the moment within the kind of
Yeah.
hospital?
So as a GP trainee, we do rotations, and within Sherwood Forest, we do them every 4 months. So this year I'm on medicine under endocrine at first, which is diabetes and hormones problems for the first 4 months. So I actually rotate next week, and I'll be moving on to A&E. So at the moment, I'm what we call like a SHO. It's sort of slightly above being the very first baby doctor when you first come out of university, a little bit more experience, but not quite a specialised registrar in that sort of department. And basically, I'm just a ward junior, so I will do seeing patients every single day on the ward round with or without a consultant or registrar, making sure that they're well, doing medication reviews, making sure we get them discharged home as well, and speaking with other members of the team, so physiotherapists, occupational therapists, nursing staff, healthcare assistants. We all work together on the ward, and my job at the moment includes being on wards, but also doing on-calls. So last week I was on call over the night shifts, and I was covering their respiratory wards as well, which was very, very, very busy, and seeing lots and lots of patients. So I was very, very tired at the end of all of that. So it's clerking patients, but also seeing any patients that are unwell overnight when there's no one else around. So if they become acutely unwell overnight or have pain or anything like that the nurses are worried about, then they call me.
So you're training to become a GP at the moment.
Uh-huh.
So within that, do you need to specialise in something beforehand, or is this 3 years and then you do your 3 years and then you become a GP?
Yeah, so basically what you do is when you finish medical school, you
Yeah.
do 2 years of sort of specialising and just moving around. So I did surgical jobs, I did A&E, I did medical jobs as well, I did ITU as well, and just sort of moved around lots of different jobs. And then you can go straight into training, or you can take a year out. And I took a year out and I did a teaching year. So I did 4 days a week teaching and 1 day a week clinical, which was quite nice for 1 year till I got redeployed for COVID and went straight back into medicine. And then when you become a GP trainee, you do 3 years, and the first 2 years are sort of moving around, like I said before. So I've got medicine, A&E, and then a GP placement in my first year.
Okay.
And then second year, I've got pediatrics, which is children, anyone under 18 to 16. And then I've got obs and gynae, which is basically women's health. So all the things, gynecological problems, including like sexual health problems, all that sort of thing. And then obstetrics, which is pregnancy and the bit when the baby comes out. So the
Okay.
pediatricians take over, and then I've got another GP block at the end. And then my final year is pure GP, so just being community and in a general practice. And
Amazing.
then if I pass all my exams, then
Which
I'll
you
be a
will.
qualified
So
GP.
at the moment, what does a typical day look like for you? Or is there no typical day?
Well, I'll start with a typical like medical day.
Yeah.
So this would be the same if you were a medical trainee as well. So like the first year medical training, I'm sort of at the same level as my counterparts at the moment, but obviously as I do more GP focused things and they do more medicine focused things, they become more specialized. So at the Kingsmill, we start at 9 o'clock on medicine. Some hospitals are different. In previous trusts, I've started at 8 a.m. For medicine, and surgery is normally a little bit earlier. And we normally start with like a board round. So we go through all the patients on the ward, and it's normally with doctors, hopefully the consultant that's on that day, the nursing staff, so the nurse in charge and whichever nurses are looking after that area. The physiotherapists normally come, the occupational therapists, and then sometimes like the discharge nurses, they're specialist nurses who help with getting patients home. So they might be specialised in talking to nursing homes and that sort of thing and getting them out of the hospital. And we go through all the patients, see if there's been any problems overnight, if anyone's been particularly unwell, if there's anything that we can do to facilitate people getting home, if there's been any issues raised that no one has been, updated about, something else has happened overnight, family concerns, that sort of thing. And then once we've done that and we've gone through all the patients, we'll sort of prioritise who we're going to see first. So if there's a really sick person or there's new patients on the ward, they normally get seen first. And then we'll go round, and it'll be it's normally a junior and then a higher grade, so either a consultant or a registrar that will go round, but occasionally it'll just be myself that'll go, or it just depends on the staffing on the ward. And if people are new or if they've been on the ward a long time, they're just waiting for a care home placement or something like that. And then we'll go around and see all the patients and do any urgent jobs. So if anyone needs any urgent blood scans, anything that needs done now because they're poorly.
Yeah.
And then hopefully we'll get to have some lunch.
Maybe not.
Yeah. Normally we do, but I always take snacks with me every day. I've like loads of snacks in my bag. I'm known for it now because I get really hungry. And if we're not having lunch till 2, sometimes a little bit later, I need a snack.
Yeah, you're damn right.
Yeah, so that's what I normally do. And then we'll come back, finish off all our jobs. Normally in the afternoon, we try and catch some patients' families if they need updating. Normally it would be done during visiting hour, but at the moment we're not having any visitors, so we try and call people on the phone, which isn't ideal, but it's better than them not knowing what's going on. Yeah. Just to make sure everyone's updated, because it's scary enough when your loved ones are in hospital, never mind them being in hospital, not knowing what's going on. So that's what we try and do at the moment. And then we normally, touch wood, finish at 5 o'clock. But sometimes obviously if there's someone poorly, we have to stay a bit later.
Yeah. So what have you done? I know you said you were on nights this week.
Yeah.
What have you done on your nights?
Oh,
here we go.
So I done a lot of my nights, which is why I'm so tired. So at the moment, everything's sort of changed in the hospital. So it is busy and we have a lot more poorly patients compared to normal, and they're really sick, some of them. So it means that normally there's just one doctor from sort of 12. Sorry, that's my dog. 1 second.
Yeah, no problem. So you were talking about your night shifts.
Yes, sorry. So night shifts are very busy at the moment, because now we've sort of changed. So we have 2 places where patients can come into. Everyone comes into A&E, and then if we think they're poorly with a respiratory problem or COVID, they go upstairs to the respiratory wards now.
Okay.
Which means, because I was covering the respiratory ward, I was not only seeing sick poorly people, but I was clerking in new sick poorly people, the new ones onto the ward. So I'll tell you a little bit about clerking a patient. So this is the first time they see a doctor on the ward, and we take a history, we make sure they've got all the medications they normally take, and all that sort of thing. If we need to ring their family, if they're really sick and we think they need to know, or just to update them, they will do all that as well. So even if it's what we call a quick clerking, normally takes about an hour, just to make sure everything's done, look through their bloods, check all their scans. If they need any, they've had a chest x-ray, but we think they need a CT scan or something like that, we have to order all of that. So that's all of that. And then at the same time, you're getting jobs coming through for someone that's very sick, someone that needs more oxygen, someone that's, in pain. So you just have to sort of prioritize who you're going to see and all that sort of thing. And during all of that as well, you hold the cardiac arrest bleep. So if there's anyone really, really sick, then you just leave and you have to go to the arrest as well. So it's sort of juggling a little bit.
So that's quick clerking.
Yeah.
It's not quick clocking. How long
But
does that take?
if they're a very complicated person, they're on, 30 medications, which isn't unheard of,
Yeah,
and you have to write all these out, check that when they take them, if they're on insulin, you have to, find out how much dose they're taking, etc., etc. Oh, it can take a long time.
yeah,
And if you have to bring the family, if they're really, really poorly, sometimes you have to bring the family in. If you think that, they're not going to make it, then
yeah,
sometimes you have to bring the family in. So doing that at 3 a.m. is quite difficult. It's hard doing it in the daytime, but when you're tired yourself, it makes it even harder.
yeah. So take me back to the start of your career. What did you study to get here?
So I think probably, well, I decided actually really late that I wanted to be a doctor. My parents are both doctors, and I was rebelling against the idea of being a doctor, and I did not want to do it at all till probably about 16ish. So just as I was choosing my A levels, I realised that actually that's what I wanted to do. I liked science and that sort of thing. So for my A levels, I did chemistry and biology because you have to, basically.
Yeah,
I enjoyed them, but they're the ones you need to get into medical school. There's very few now that won't accept either one of them. There's some that'll just accept biology, some that'll just accept chemistry still, but most of them are asking for both of them. And then I did maths as well because I enjoyed it. And then I did PE because I really enjoyed doing PE. It was sort of like my break from it. And also I found that I did more human biology in PE than I did in biology. Biology was mainly flies and mosquitoes and that sort of thing. But PE did a lot of sort of biochemistry, muscles, all that sort of thing. So I actually knew quite a lot of my anatomy before, just like the main muscle groups from the PE. So I really enjoyed that. I definitely recommend it. And also it gives you an outlet. So it's one of the most important things as a doctor is to do something you enjoy as well. So mine is sport. So it meant that I'd already established that before.
okay. So in terms of study, after you did your A levels, you went to uni. So can you tell me a bit about your uni journey?
Yeah, so I went to Hull York Medical School, so it's based up in Yorkshire, not too far away, and it's what we call a PBL university, so it's problem-based learning, where you get given cases every week, and then you sort of talk through them with your group, and you choose outcomes. So say you get a patient that's come in with sort of diabetes, so you look at sort of the pathophysiology, which is what the disease process of the problem. You'd look at lifestyle factors, you look at sort of management and treatment for that thing, and it sort of builds it around a patient, which made it quite well, when I say easy, to remember things, because you can sort of attach it to someone.
Yeah.
And then you'd go to hospital placement. So you do placement from year one at my medical school, and you'd either go to GP or hospital every week. Even in first year. So it meant you'd go and see a patient on the endocrine ward who had diabetes. You could talk with them, and sort of it just all sort of places it on top of each other, if that makes sense, to sort of solidify your learning. And then as you go through the years, you'll sort of add to it. So the first 2 years are mainly university based, and then years 3, 4, and 5 are all sort of in hospital or in GP.
Yeah, essentially just doing the job.
Yeah, so you're sort of in placements in different areas, and they'll take you through everything, and you have different learning outcomes. It's quite an independent course, so if you want to be spoon-fed, it's probably not the course for you, because you have to do a lot of the work yourself, and you get given sort of learning outcomes and you have to learn yourself. So it's very, very different from school, and it changes a lot. And also you realize that you are not the smartest cookie out there. You go from being, quite clever in your class to being absolute average, which it can be a bit weird for some people, I think, and because obviously now the requirements are, I think it's A star AA in a lot of places, or 3 A's still. When I went, it was sort of A B or ABB or 3 A's, so it depends, but it's getting higher and higher every year, mainly because of more people wanting to do it. You don't need 3 A's for sure. You just need to be committed to doing it. but yeah, so you go from being very high in your class to very just sort of average.
Middle of the pack.
Yeah, and sort of the exams are completely different. So instead of having to get 80%, they're really hard. So you need about 50% to pass, because that's how hard the exam is. So you'll feel like you know nothing, but you will, and it'll slowly all come together. And then between my 4th and 5th year, I did what we call an intercalated degree. And so they sort of assume that you have enough knowledge from your first 4 years to have done the first 2 years of a degree. So you can do a BSc or even a master's in 1 year. So I did mine in urgent and emergency care, which was great. So that was at the University of Plymouth. So it meant that I moved around a little bit. Yeah. And then I came back to Hull and did my final year and then graduated from there.
Woo!
So it's a long time, and you'll realise everyone else sort of moves on with their life. You know, if your friends go to university, if not, they might have already gone and got jobs at 18, started to earn money at 18, and then your other friends might leave at 21, gone and got jobs at 21, and then you graduate at 24. Everyone else is, you know, got a house and car and stuff, and you're sort of got a lot of debt. And nothing else. You do have a degree though, maybe 2, but yeah, so it makes everything a little bit different. You will catch up, but it'll take us some time.
But that doesn't matter. Everybody does things in their own time anyway, don't they? So
yeah, absolutely. It's just something to be prepared for.
Yeah.
They'll all start doing the fun holidays, and you know, where you have to pay money to yeah, and you don't have the money.
Would you say your whole journey in terms of studying has been easier or harder than you expected?
I think the volume is bigger, but actually the difficulty of it isn't always as hard as you think it was. As I said, the entry requirements are getting higher and higher all the time. I was speaking to my mum when she went, she got A, D and C in her like equivalent of A levels, and my dad got worse than that. So you don't, and you know, they qualified fine. So in some ways it's easier, but the sheer volume, you will never know everything, and I've realized that now, and I'm comfortable with that fact. That's why we have all these different, if you think about how many different types of doctors are, you have, you know, your general practitioner who knows a little bit about most things but not a specialist. That's why you have to refer to secondary care in the hospital. And then you have, you know, someone that specializes in endocrine, but they might specialize in, you know, thyroid, and you get super specialism, and it's just because it's impossible to know everything about everything.
Exactly.
And you just have to sort of accept that.
Yeah, and just try and
know what you don't know is probably the best thing. Best advice.
So have you got any kind of tips for pursuing a career in your kind of field? I know you said there's a lot of work to do and you need to be committed.
Yeah.
Anything else that you kind of recommend?
So as I said before, top tip, make sure you have something else you enjoy. Mm-hmm. You do not want to be just living your life as a medic, because you will burn out, and it's really, really important to have something else that you enjoy. So whether it's sport, baking, just reading a book, all that sort of thing. So see what you enjoy while you've got the time. Find out what you enjoy. And then my other top tip would be get as much information as you can. As I've said, you know, we see things on TV, casualty, etc., but it doesn't really show you how good it can be, because being a doctor is amazing, and I love my job, and I wouldn't change it for the world. But we get the honor of being there at the best times of people's life and seeing the most amazing things that can happen to people. You know, we're there at people's births, we're there when they have their last chemo, all this sort of thing, but we're also there at the very worst of people's times as well, and that reality sometimes is really hard. So learning about that, and asking people, you know, sometimes you don't have a wee for 12 hours. Sometimes if it's really that busy, you forget to eat, you get to the end of the shift and you're knackered. So learning about all those sort of things would be my advice. being a doctor isn't for everyone, and there's loads of other careers where you can do other things inside it. So sort of getting as much information and working out if it really is the right path for you. You don't have to go straight away. We're not going to retire till we're nearly 70 now. So at 18, you got loads of time. So
Yeah.
if you need to take a year out, get a job, because I think at the moment getting experience might be extremely difficult. I'm assuming they're not letting anyone into
They're not
hospitals.
letting anybody
Um,
in.
so any sort of volunteering. So when I did my like stuff beforehand, I volunteered at like a sports club for adults with different disabilities. Mine was all around sport, so this might not be best for everyone, but it was sort of doing different sport things for that. And then I did like bike riding for people with disabilities, so just going out on specialized bikes with people that had wheelchairs and that sort of thing, so that I could just help them with that sort of thing. And then sort of working in a GP practice, which might be difficult at the moment as well. I appreciate that. But if you wanted to take a year out, working as a healthcare assistant, you're never going to get a better insight into how rubbish it can be at times, but also how good it can be at times. It'll just give you that bit more insight, because yeah, it's going to be hard to get experience at the moment. But all these sort of volunteering things, or you could do it over the phone, actually. That would still count. Like a lot of the mental health charities are looking for people for ringing them. Age UK are looking for support people to ring round elderly people. So that would all count as experience as well. And you sort of get an insight into these people's lives that are struggling the most at the moment. So yeah, that's what I would recommend.
That's a really good idea about doing the phone call thing.
Yeah, because it's all experience, and it's all learning how to talk to people and different people as well, because we get very used to our little bubble and not really knowing who's outside of it. And as a medic, you will meet huge scale of people. You will meet, people that millions of pounds. In some instances, you will meet people that are homeless and have come in and have got nowhere else to go. So you'll meet lots of different people. It's good to get to learn to talk to everyone. I found that my accent changes depending on where I am. If I'm working in, say, because I'm from Hull, but I don't have a Hull accent, but if I'm working in A&E and someone comes in with a really strong accent, I will go proper Hull on them and then start talking like that. And I was working in Wales, I developed a Welsh accent. Sometimes that comes out. It's really strange, but I find it helps talking to people.
A moment ago, you mentioned that being a GP or kind of doing medicine isn't maybe for everybody, and there are other roles kind of within the hospital. Can you just touch on those other roles just a little bit?
Yeah. So I actually didn't get into my medical school when I got my A-level results. So I straight away started researching everything. I did get in a couple of weeks later after ringing them 3 times a day, every day, and just pestering them. So that would be another tip. If you don't get in straight away, just keep trying, if you know that's what you want to do. But so there's other roles. So there's physiotherapy, who sort of help patients with mobilizing and making sure we get them back to what we call their baseline. So if someone comes in and they're able to walk with one stick, the goal is to get them back to that so that they can carry on doing what they were able to before. And that can be using lots of different techniques. It'll also be sort of post-operative. So if someone comes in and has their hip replaced or their knee replaced, it's to get them moving as soon as possible to get the best benefit out of that as well. And they can work in community and hospital as well. So there's a lot of different roles within that. We also have chest physios, who are really important at the moment. And I'm not 100% sure on, but they do a lot of good stuff. They
Yeah.
bang people's chests and they make them a lot better. And they're very, very skilled. They're occupational therapists. They sort of help patients with getting the best out of what they've got, giving them techniques on how to do different things. And they're very, very good at putting adaptations into houses, knowing how to help patients and give them sort of their independence so that they can carry on living at home if they need to. And then another one I looked at, which is a bit of a curveball, was being an optometrist. So that's there's an optician, what you'd know as an optician. So that's a 3-year degree. And that's obviously someone that focuses on eyes. And it's actually really, really interesting. You learn a lot about the anatomy, how you can help people, and obviously being able to see is, you know, an amazing gift. And so if you can help patients with that, that's another thing. But most of those are private, so actually your earnings are a little bit better. So another thing I was going to say, if you just want to earn money, medicine is not the job for you. It's not worth it. So yeah, so there's loads of different roles within there. So having a little look around and seeing. Also psychologist, if you prefer sort of the mind sort of thing, you can always do that. So we have psychiatrists who are doctors that are trained, but you can do psychology and then do a psychology PhD and become a clinical psychologist rather than psychiatrist. So there's lots of different routes into different things that you can always do. And there's sort of foundation degrees and biochemistry degrees and medicine degrees that you could always do before if you're not sure as well.
Okay, amazing. Is there anything you'd have done differently throughout the course of your journey?
Yeah, so one thing I would have done differently is have a gap year. I think like the reason I didn't is because I was very lucky. I was the last year before the fees went up. Okay. So financially, it made a lot of sense to go straight from school, because paying an extra £6,000 for 5 years is quite a lot of money. So that was one thing I would have done differently, just to get a bit more experience, because I've realised as an 18-year-old, actually, even just in nearly 10 years, you realise how little you actually knew and how naive you were of the world at that point.
You think you might know it all, or
Yeah,
might know
you don't. And you still realise you don't know that much, you know, whether you're 28, 38, you know, however old you are. But yes, probably maybe have a gap year. But I don't think it would have changed all that much, but might have given me a bit more experience and given me a chance to earn a bit more money beforehand. And I don't think it would have made any difference. There's no rush, as I said. So having that extra year is always good.
Yeah, amazing. Have you got any kind of recommendations in terms of maybe books, online resources, podcasts, anything that the students?
Yeah, so I have a little look. So one book that I would recommend is This Is Going to Hurt by Adam Kay. So he's a junior doctor who wrote a book about basically everything that's happened to him, and just going through some like sort of true stories about what's happened and some horrible stories that also can happen. So that would be a really good book to recommend. And another really good book that I think would be a good one is something called It's All in Your Head. And that's by Susan O'Sullivan. And she's a neurologist, but it's basically talking about a lot of what we call psychosomatic disorders. So these are psychological problems that manifest sort of with physical problems. And mainly I'd read it early, because once you start, you might hear things about different problems and have a point of view brought across by older doctors who might have different points of view. And it's a really good book to go through. So I definitely recommend reading that early. I really enjoyed that book. And then I'm a big podcast person. So one that I'd recommend is one by Dr. Rangan Chatterjee. He's a GP, I think in London. I think he's a GP in London. And it's called Feel Better, Live More. And this is not really about being a doctor necessarily, but it's about recommendations, and he gets experts in on how you can not make your life better, but ways you can sort of help yourself. So they get sleep experts on, all this sort of food experts, exercise experts, loads of different, but they're all either doctors or people that have PhDs in this sort of thing. So it's very science-based. And then he relates it to what he does with his patients as well. So, you know, talking through sleep routines with patients and that sort of thing, because you won't get taught that very much in medical school. We do a lot of other bits, but we don't really do any social prescribing, talking about exercise. We don't really learn very much about nutrition and all that sort of thing, which is really, really important, and your patients will ask you. So I listen to that podcast quite a lot.
Amazing.
They're quite long, so it's good for like a long walk or something like that.
Yeah, cool. Thank you so much for all of that.
No problem.
With the video so the students can go and have a look and do a bit of research. And thank you so much for coming to speak to me. You've given a lot of insightful information.
That's all right. Hopefully you could understand it all.
Yeah,
Haven't
no,
talked
it's
too
really,
fast.
really good. No, you don't. It was very, very clear and concise. So thank you so, so much.
Cool, no problem.
Enjoy the rest of your day.
Thank you.
Thank you. Bye.
Bye.